Um, but first of all, good morning, good afternoon, everyone, and thank you for joining us today. We're delighted to have you here. Over the next hour, we're going to get into something we're pretty passionate about, and something that we think has real practical implications for how we work day to day, and that's gaining regulatory advantage through structured content. We'll keep this very grounded, we'll be honest, and we'll make sure you leave with things that you can actually act on. So, as I mentioned, we will be recording this, and without further ado, we'll start with some quick introductions. So, I'm Caroline Masterman Smith. I'm a managing director in R&D advisory here at Red Nucleus. My focus is on operating model design. I work with organizations to figure out how they translate technology into something that actually functions in practice. So that means I spend a lot of time looking at how teams are structured, how decisions get made, and where things can break down between design and reality. And I'm joined by Marissa.
Hi, everyone. I'm excited to be here today. My name is Marissa Burgos, and I am a senior project manager at Docuvera. I've had the privilege of partnering with a variety of pharmaceutical organizations as they transition from traditional document-centric authoring to data-centric structured component authoring. Throughout that journey, I've seen firsthand how structured content management can transform the way teams create, manage, and maintain regulatory content, really driving greater efficiency, consistency, and content reuse across the organizations. I'm really looking forward to sharing how structured component authoring can not only help streamline your labeling and content processes, but also position your organization to meet the evolving health authority requirements as the industry continues its shift towards a more data-centric future.
Perfect. Thank you, Marissa. So between of us, we've seen sort of both sides of this, how programs are designed and how they actually land. And that dual perspective is really what shapes today's conversation. We're not coming at this from theory, we're coming at this from what we're seeing working and what we're seeing maybe the challenges are across the industry. So with that, I'll just start with a few quick housekeeping points. We'd love this to be interactive, so please do use the chat to ask questions as we go. We'll be keeping an eye on that throughout, and we'll also have time at the end to address any questions. Also, if you'd rather, please feel free to send direct questions directly to myself, Marissa, or Colleen, who's the host of the webinar, in the chat if you'd rather not put questions in the group chat. Not a problem at all. Don't hold back, whether it's clarification, a challenge, or something that you'd like us to dig into a bit deeper. We'd love to hear from you. So with that, we'll go into just a quick company overview. Marissa, over to you.
Great, thanks, Caroline. So I wanted to start with a brief introduction into Docuvera and what really differentiates us in the life sciences content space. So Docuvera is a governed, structured, AI-enabled content platform that's built specifically for life sciences. And we help organizations govern and operationalize their regulated content at enterprise scale, particularly in highly regulated environments where traceability, reuse, and consistency matter. Docuvera was founded in 2017 as a spinoff from AuthorIt, and today we've grown to more than 100 employees globally. We're headquartered in New Zealand, and in May of 2025, we were acquired by Cormio, which is under the Bertelsmann umbrella. So that really helped further strengthen our scale and long-term investment in the platform and broader life sciences strategy. Our focus at Docuvera is simple. It's enterprise pharma, and we connect clinical, CMC, and labeling content flows together through governed component reuse. And that's really one of the biggest differentiators for Docuvera. Cross-functional reuse across those domains is no longer conceptual. It's completely operational in Docuvera today. So that's super exciting to share. Our focus is enterprise pharma, and we work with many of the world's leading pharmaceutical organizations, including 8 of the top 20 global pharma companies. Our platform supports, again, global labeling, clinical, CMC, medical information, safety, and quality use cases across the product lifecycle. This becomes increasingly important from the perspective of cross-functional reuse across those domains, as organizations move away from siloed documents and towards enterprise content ecosystems where information must be governed, reused, and operationalized consistently across functions and markets. We also align closely with industry modernization initiatives, including EPI, FHIR, IDMP, and Annex 11. And that really helps customers prepare for evolving regulatory expectations and AI-driven operating models. We are here to help organizations shift from a document-centric to a data-centric approach through creating, governing, reusing, and operationalizing regulated content more effectively while preparing for the future of structured AI-enabled regulatory operations. Really looking forward to the discussion today. And with that, I'll hand it over to Caroline to talk a little bit about Red Nucleus.
Excellent. Thank you, Marissa. Yeah, I'll give you a quick sense of who Red Nucleus is for those who may not be familiar. So, Red Nucleus is over 900 people strong and growing with a truly global presence. We've got offices around the world. We bring diverse expertise across the life science industry, spanning global medical affairs, communications, commercial consulting, value and evidence, so market access, research and development, and learning and development. I sit within our R&D team, and what ties all of that together is a mission to improve the health of patients around the world by solving healthcare's most pressing challenges. And structured content governance is something that I believe can help with the speed of getting drugs to market. So that's where we're really coming into sort of the partnership here with Docuvera and sort of supporting organizations in that transformation journey. So with that context, let's look at why this conversation is so timely today. So the shift is straightforward, but it really is significant. Regulatory content is no longer being consumed only as documents. Regulators are increasingly consuming content as structured, queryable data, and that fundamentally changes what they expect from us. So this isn't a future state aspiration as such. It's already visible across multiple live initiatives. Things like EMA Daddy is replacing static PDFs with structured digital forms, and then FHIR-based EPI is mandating the machine readable labeling. And there's many more which we'll go into a little bit more detail shortly. But that common thread across all of these is really clear. The content must be governed, structured, and interoperable. And that's really that new baseline. So the question for everyone is not whether structured content matters. The question is really whether your operating model can actually support it. And that's a much harder question because it's not just about the technology. It depends on how content is designed, how it's governed, and how it's managed across the organization. And when those things align, some really powerful capabilities unlock. Things like impact analysis becomes a system function rather than an exercise in things like institutional memory. Reuse becomes measurable. Dependencies across your content become visible. And your content starts generating that regulatory intelligence that has always been there, but it's maybe locked inside the document-centric architecture. And most organizations already have that intelligence. They just maybe haven't yet built the structure to surface it. So with that in mind, here's what we're going to cover today, and it's deliberately practical. First, we'll look at what the external regulatory environment is now signaling and what that means operationally, so not just theoretically. Then we'll explore why so many structured content initiatives and technology implementations as a whole really can stall after go live. From there, we'll focus on what actually distinguishes organizations that achieve that sustained adoption and maybe what they're doing slightly differently to keep that sustained. And finally, we'll look at what becomes possible when governance, structure, and readiness truly align. In terms of what you'll walk away with, We want to give you a practical understanding of why these programs either succeed or stall, a clear picture of what regulators now expect, a bit of a diagnostic lens you can apply back at your organization, and some specific actions you can take away regardless of where you are in your structured content journey. So let's start with the regulatory signal.
Great. Thank you, Caroline. So the first area I want to touch on today is the regulatory signal. And that signal is that content is becoming data. As you look at this slide, the most important takeaway is this. These are not isolated regulatory initiatives. FDA, EMA, and other global health authorities are all moving towards the same future state. Content is no longer being treated primarily as documents. Content is becoming data. For decades, the industry operated in a document-centric world with Word documents, PDFs, and narrative-heavy submissions that are designed primarily for human reading and review. But regulators are increasingly building ecosystems designed to consume structured, machine-readable, and interoperable information. And that changes not only how submissions are reviewed, it changes what regulators fundamentally expect organizations to produce. Going forward, success is not simply about generating documents. It's about whether underlying content is governed, structured, traceable, reusable, and computable. Now, what's interesting is that the initiatives on this slide may appear unrelated on the surface. CASA, DOTI, PQCMC, EPI, and AI pilots, but collectively they reinforce the same direction. So starting on the left with FDA CASA. CASA is one of the clearest examples of regulators operationalizing structured data for algorithmic review and risk assessment. Historically, FDA reviewers manually interpreted narrative submissions, and CASA began shifting that paradigm by enabling systems to identify trends, inconsistencies, and risk signals algorithmically. Human review remains central, but regulators increasingly expect structured, comparable information that systems can analyze consistently. Next is EMA DADI. DADI shifts regulatory applications away from static PDF forms toward structured web-based application data. That shift matters because it signals a very important conceptual change. The data itself is becoming the regulatory artifact, not merely the document that represents it. As regulatory agencies continue to embrace structured data-driven submissions, organizations must shift their focus from managing documents to managing trusted data. In this model, data becomes the single source of truth, while documents increasingly serve as generated outputs tailored to support specific health authority requirements. When content is created, maintained, and governed at the source, organizations can have confidence in both the accuracy of the content and the integrity of its reuse. The result is content you can trust, and that's huge. Driven by trusted data, maintained once and leveraged consistently across multiple documents, submissions, and markets. That is a major operational shift because governance, metadata, and structured authoring become foundational capabilities rather than optional efficiencies. PQCMC continues that same trajectory into quality and manufacturing information exchange. The emphasis here is structured, reusable quality data rather than repeatedly recreating static narratives across submissions. And for organizations operating globally, that becomes especially important because CMC information is often among the most reused and operationally complex content in the enterprise. Then we move into FHIR-based EPI. Traditionally, labeling was treated primarily as human readable text intended for PDFs, package inserts, or Word documents. But FHIR-based EPI changes the expectation. Now, labeling is increasingly expected to exist as machine readable interoperable information capable of integration across healthcare systems, provider systems, patient applications, regulatory databases, and digital health ecosystems. That is a very different future state. And importantly, once labeling becomes computable data, organizations need significantly higher levels of consistency, governance, traceability, and content interoperability across functions. Because suddenly inconsistencies that may have remained hidden in narrative documents become highly visible in structured ecosystems. And finally, AI. FDA AI pilot programs are important because they represent the next logical evolution of everything we just discussed. AI-driven review introduces the ability to cross-validate narratives against source data, identify inconsistencies, and evaluate patterns at scale. But AI only works effectively when content is governed, connected, and machine readable. So AI is not creating the shift. AI is accelerating a direction regulators were already moving towards. And that leads to the central point on this slide. The future regulatory operating model is increasingly governed, structured, interoperable, and data-centric. The question organizations need to ask themselves, as Caroline previously mentioned, is the current content and operating model actually designed to support that future state? Because in many operating models where they were built for a document-centric world, while regulators are increasingly operating in a data-centric one. Organizations that adapt successfully will be significantly better positioned for scalability, consistency, AI enablement, and long-term regulatory readiness. Now, to talk a little bit about what makes adoption stick, I'll hand it back over to Caroline.
Perfect. Thank you, Marissa. Yeah, so that's the external pressures. The next question really becomes why do so many internal programs struggle to keep pace with that? Because the reality is most organizations understand the regulatory direction. The challenge isn't awareness, it's in the execution, as Marissa mentioned. So let's talk about what actually makes adoption stick, and why it has to be designed around how teams really work. So at the center of this change is a fundamental shift. It's worth spending a bit of a moment on that because everything else follows on from it. The structured content authoring changes the unit of work from the document to the component. And that sounds simple, but the implications can be huge. I mean, the benefits are clear. The lower cost, faster time to market, higher quality, and better experience for authors, reviewers, and the downstream consumers of that content. And when you move to components, you stop duplicating effort, you stop reconciling versions across documents, you create once and reuse with confidence. But and this is where many organizations can hit a challenge or hit trouble. This shift is also fundamentally changing how people work. It changes what they review, what they own, and what they're accountable for. And what we see in organizations implementing structured authoring platforms, they're implementing, but they're continuing to operate in a document-centric way. The technology is component based, but the workflows are still designed around the full document. So ownership is still tied to documents, governance isn't visible at the component level, and the review process still expects someone to read and approve the entire assembled document rather than kind of validating individual governed components. And that mismatch can create friction. And where there's friction, teams don't necessarily complain about it, but they'll find workarounds. They'll copy content into local files, they'll reauthor instead of reusing, they'll build kind of shadow processes that sit outside the system. And before long, you'll have your structured platform, but with unstructured behavior. So it's worth being pretty specific about this one. Most structured content challenges are not the technical challenges, they're operational and sort of organizational. So, what actually makes adoption stick? We've worked with organizations at different stages, different scales, different levels of maturity and implementing new technology. And what we find is that it comes down to a relatively small number of critical design decisions made early. And although change management is critical, this isn't about heavy change management programs with, steering committees and 12-month roadmaps. It's about getting a few fundamental things right at the point where they matter most. And that's before go live, not after. Um, so we see five priorities that kind of separate these organizations, the ones that kind of sustain that adoption and those that might struggle. First is designing the process around the new unit of work. And if your workflows still assume documents at the unit of review and approval and things like that, you can feel that friction. And second, making governance visible so teams can trust it. Marissa mentioned earlier about the trust, and this one is huge. So you can really have trust in those components. People won't reuse content that they can't verify. If they can't see who owns the component, whether it's approved and where it's been used, they'll recreate it. And third, clarifying who owns what before it becomes a bottleneck. So this really links back to that governance piece. Structured content redistributes the responsibility. And if that's not addressed explicitly, it can create a bit of paralysis in the ways of working. And then fourth, right sizing the rollout. So the temptations to go enterprise wide from day one, but it can backfire because momentum comes from that visible success, not necessarily it being mandated that this new system has to be used. And fifth, sustaining the model without building a permanent program around it. So the goal is really to embed this governance into how the work happens, not maintain it in indefinite change management functions or anything like that. These items and obviously the successful stakeholder engagement and change management really drive adoption. And I think we'll go into each one of these in a little bit more detail on why they matter and why they're so critical. So the first priority, and for me, arguably the most impactful, and it's designing your process around the new unit of work. This is where there can be sort of common or damaging mistakes that can happen. Organizations invest heavily in a structured authoring platform that configure the content model, define the components and everything like that, and then layer their existing document-centric workflows right on top of it. So what happens? You end up with component-based content being routed through document-based approval processes. And people are still being asked to review a assembled document when what they really should be doing is validating those individual components. Review cycles become longer than normal because the scope is still that entire document. Ownership is unclear because the process doesn't distinguish between the person who owns that component and the person who owns the assembled output. And that can create friction from day one as well. And that doesn't just slow things down. It can actively undermine like the confidence in the model. Teams start to feel like the new system is harder, not easier. And once that perception takes hold, it's very hard to reverse. So instead, what needs to happen and what we see being successful is redesigning that workflow to match the new unit of work. That means shifting teams away from reviewing entire documents and towards kind of stewarding smaller reusable components. In practice, that looks like shorter review scopes focused on those individual components or small groups of related components. It looks clearer ownership defined at that component level, not the document level. And approval gates that sit at the right or appropriate governance tier. So a core safety statement, for example, has a different approval path than a local market adaptation, as an example. The earlier you make the shift, the smoother the adoption becomes. If your process still thinks in a document way, adoption will stall, and no amount of kind of training and communication will fix that process design challenge. And this actually links very closely, all five of these link very closely together, but to this second priority, which is making that governance visible. And this one is absolutely foundational because reuse depends entirely on trust. And the whole promise of a structured content system or using structured content is that you create a component once, govern it properly, and then reuse it wherever it's needed. And that's how you get the consistency, the efficiency, and the traceability. But that promise only really works if the people making authoring decisions can actually see there and then and trust the governance behind each component. So if people do not reuse content, they cannot verify. If a regulatory writer is looking at a component and they can't immediately see who owns it, whether it's been approved, when it was last reviewed, for example, and where else it might be being used in the system, they won't reuse it. They'll recreate it. And not because they're being difficult or anything like that. It's because they're being responsible, right? They can't put their name to something or to the content that they can't verify. And that again is a design gap. It's not a training gap. You can run as many training sessions, things like that, as you want, telling people to reuse the governed content. But if the system doesn't make the governance information visible and accessible at the point of authoring, behavior won't change. So in practice, what that looks like is surfacing the component ownership, the approval status, the version history, the usage lineage directly within the authoring environment, not kind of buried in a separate system or available through searching and things like that. It has to be right there at the moment that decision is being made. When teams can see that a component is current, it's approved, it's owned by an actual named individual and already in use maybe across 3 different markets, they can trust it. They reuse it more confidently. When they can't see any of that, the default is what feels safe, which is creating their own version or doing something outside of the standard process. So the goal is to design the system and the process so that trusting the governed content is actually genuinely easier than finding a workaround. And that then leads us to a very linked third option, which is the question of ownership, because visibility without clear ownership is only really half of the story. So again, clarifying it needs to happen right at the start in that design phase, not after launch. Structured content fundamentally redistributes responsibility. In a document-centric world, ownership is relatively simple. Someone owns the document, they control it, they approve the changes, and they're accountable for its content. In a component-based world, the clarity evaporates a little bit unless you're deliberately recreating it. A single governed component, for example, say a core safety statement or dosing recommendation, it might be reused across multiple products, markets, document types. It could appear in a CCDS, an SMPC, USPI, many different documents. And each one of those contexts has different stakeholders, different regulatory requirements, and different approval expectations, really. So who owns that component? Who can change it? Who needs to be consulted? And what happens when a market-specific adaptation is required, for example? Does the local team have the authority to modify it? Does it need to go back to global owner? And without clear answers to those types of questions, teams can really get stuck when utilizing the system. And when that happens, confidence in the model can really erode. Not because the model is wrong or anything like that, but because the ownership layer wasn't defined and wasn't clear enough to the team members. And this could possibly happen in a number of different occasions, but with stakeholders, for example, previously controlled a full document, a labeling manager maybe who owns the entire CCDS, for example. Now they need to understand how their role translates into a component model. And if that translation isn't made explicit, you could get challenges or resistance to the process. The ownership model also needs to include a defined change path. It's not enough to say this person owns the component. You also need to define how that can be changed, how's the change request raised, for example, evaluated, and how's that then propagated to downstream users. Without that, every change becomes a bit of a challenge, bit of a negotiation. There's always that back and forth. So resolving those ownership questions during the design can save you an enormous amount of challenges downstream. So even with the right processes, governance, and ownership in place, how you actually roll out this can really matter. And that's where we kind of focus here on right sizing that rollout. And this is where I mentioned earlier, ambition can sometimes work against you here. So there's a natural temptation, especially when leadership is bought in and the business case is really strong, to go big from the start and roll out across multiple content types, regions, therapeutic areas, get everyone onto the platform as quickly as possible and maximize that return on investment. But what you can see with broad rollouts, it can sometimes create broad resistance. When you try to change everything at once, you can overload teams, you can surface a lot of edge cases, for example, all at once. You don't give everyone a chance to see the model working before they're asked to adopt it. So instead, you can potentially start deliberately smaller. So maybe pick one content type, maybe labeling or CMC, because those tend to have that clearest reuse patterns and the most immediate regulatory pressures that Marissa was talking to earlier. And define a bounded scope, maybe one product, one region, one team, and focus on making that work really well. And the purpose of that isn't just to prove the concept or anything like that. It's to create a visible reference point. When other teams can see a real team working on real content, getting real results, they get the faster updates and things like that. That really creates a pull. People want to be part of something that's working well. And that's very different to being told like you have to adopt something by email or something's getting rolled out and you're kind of forced to work on it. You can see those real results and get that momentum. And a point that often gets overlooked here, you need to communicate those early wins as actively as you deliver them. Success that nobody sees doesn't create the same amount of momentum. So share the metrics, share the stories, show the team members what they used to do and what they do now and what those improvements are. Make it tangible and relatable. And that's really how you create the genuine momentum amongst this and really helps enforce those change management activities that goes alongside all of this. So that brings us to the final point, which is actually making the model sort of sustain itself over time. And this is something that again can easily be overlooked in the early stages. So when you start, there's energy, there's budget, there's dedicated resources driving the initiative forward. But at a point in time, the project team moves on, the consultants leave, whatever it is, the program governance structure winds down. And the question becomes, does that model continue to work or does it sort of quietly degrade over time? And what we see with organizations that do this really successfully is that they've embedded governance into how like the day-to-day work happens rather than maintaining it as a separate function. So governance logic is built into the roles themselves. So when someone takes on a new position, their governance responsibilities come with it. Decision rights are documented and enforced through the system, not through tribal knowledge or, word of mouth and things like that. And workflows reinforce the model naturally. So doing the right thing is the path of least resistance in the systems. And this matters particularly when you think about scale. So new content types will be onboarded over time. New teams will join the model. New people will join the organization. People leave, will be replaced. If governance depends on specific individuals, it becomes very fragile. It works as long as the people are there and the meetings are happening and things like that. But the moment they're not, the workarounds can easily come back. So the goal is really that structural resilience. You want a model where a new team member can join, look at the system, and understand what's expected of them without needing a 2-day induction or lots of different trainings on governance principles. The system and the process should teach them. And when you get all of these 5 sort of priorities together and right, the process, governance, ownership, rollout, and sustainability, you create the conditions not just for adoption, but for something much more valuable. You create those foundations for the kind of regulatory intelligence that's always been there, but the structured content makes possible. And that's really what we're going to explore on the next section here is sort of what that looks like in reality.
Great. Thank you, Caroline. So now that we've discussed how regulators are shifting from document-centric to structured, machine-readable, data-centric approaches, the next question becomes, what actually changes operationally when content is governed and structured that way? This overview is going to focus on an important idea that governed structured content does not create intelligence out of thin air, right? The intelligence already exists inside the regulatory content ecosystem. What really changes is visibility. So once governance, metadata lineage, and reuse are embedded directly into the architecture, organizations gain visibility into relationships, dependencies, inconsistencies, and operational signals that were previously hidden inside disconnected documents. So over the next several slides, we'll talk through 6 operational outcomes that governed structure makes visible. So let's talk a little bit about the premise. As we transition from the regulatory signal discussion, the next question becomes, if regulators are increasingly expecting structured, machine-readable, interoperable content, what actually changes operationally when organizations move to governed structure? And the core premise is this, that most life sciences organizations already possess the intelligence regulators are looking for, like Caroline mentioned. The information already exists. The problem is usually not missing information. The problem is that traditional document-centric architectures make that intelligence extremely difficult to govern, to trace, to analyze, to operationalize, and to scale. And that distinction is incredibly important. And historically, documents become the center of the operating model, and teams author documents via reviews, approvals, submit, and then they manage them from there. But once the document becomes a unit of work, organizations lose visibility into the relationships between the underlying content itself. And that creates hidden operational complexity because the intelligence regulators increasingly care about, like lineage, traceability, consistency, reuse, metadata, and relationships, does not naturally live at the document level. It lives beneath that document level. What governance structure changes is not simply how content is stored, it changes whether the intelligence already embedded inside the content becomes operationally visible. This is the key shift. So as you move visually from left to right on this slide, you can see that evolution. On the left in the document first era, organizations operate through PDFs, Word documents, manual reconciliation, disconnected files, and static outputs. But on the right, the structured digital regulatory era assumes something very different. Regulators increasingly expect content that is machine readable, traceable, interoperable, and reusable across ecosystems. And once governed, metadata, lineage, and approvals are embedded directly into authoring itself. Intelligence stops being a manual reconstructive exercise and it becomes a system property. Now, with that premise established, the next question becomes, what specifically becomes visible once governed structure is in place? And that moves us into this next slide about the causal chain. So this slide is the architectural foundation for everything that follows. Governance is the prerequisite, structure is the mechanism, and intelligence is the result. Organizations often attempt to jump directly to AI, automation, or analytics without first establishing governance and structural discipline. But intelligence without governance is very fragile. Without governance, structure becomes just cosmetic. And without structure, governance becomes difficult to operationalize consistently. But when we see these both exist together, something really important happens. Relationships, dependencies, and operational intelligence begin surfacing naturally as system capabilities. So instead of reconstructing relationships manually after the fact, the relationships already exist within the architecture itself. And that creates a series of operational outcomes, which the next 6 slides will walk through those outcomes one by one. So let's start with the first outcome, which is cross-document dependency intelligence. This is one of the areas where organizations often realize how little visibility they actually have in document-centric environments. Today, once a statement begins propagating across products, markets, submissions, labeling documents, patient materials, medical information responses, many organizations lose precise visibility into where it exists downstream. Teams compensate through spreadsheets, manual inventories, SME memory, email chains, and tribal knowledge. And while that might work on a small scale, it becomes increasingly fragile in global regulatory operations. In governed, structured environments, downstream relationships become traceable by design. The system understands where that content is used before changes are made, and that fundamentally changes change management. So now instead of discovering downstream impacts after submission, preparation's already started. Organizations can proactively assess propagation paths and downstream risk before action is taken. And that matters because regulatory risk increasingly exists at the relationship level between content assets, not just within isolated documents themselves. And for many organizations, this is one of the first major operational benefits they experience because it immediately exposes how interconnected regulatory content actually is. And that'll lead us into our second outcome, which is commitment coherence intelligence. This becomes increasingly important as regulators move towards structured validation and consistency analysis. Historically, organizations struggle to maintain precise alignment between what was approved, what was submitted, what currently exists operationally across markets, and product variants. In document-centric environments, inconsistencies often remain hidden inside narrative reconciliation exercises. Teams manually compare versions, search through documents, attempt to reconstruct historical approvals, and discrepancies can remain difficult to detect until late in the process. But governed structured models change the unit of authority. The authoritative object is no longer the document. It becomes the governed, reusable statement itself. The example on this slide illustrates that really well. So at the top, you see an approved dosage statement with lineage, metadata, and approval status intact. Below it, you see a current variation state where the dosage language has changed, but the approval lineage no longer exists and no longer aligns. So that discrepancy immediately surfaces as a data level conflict, not as a hidden narrative inconsistency buried across documents. And this is exactly the type of signal emerging regulatory systems are increasingly designed to detect. CASA, PQCMC, structured review ecosystems. They all increasingly depend on consistency, traceability, and computable relationships. Now, once organizations begin governing commitments at the component level, another important capability emerges. The content itself becomes queryable, which brings us to our third outcome. Metadata as a regulatory signal layer. The third outcome is metadata becoming operational intelligence. This is one of the most overlooked, but most strategically important shifts in governed structured environments. Metadata stops being administrative overhead and instead becomes a regulatory signal layer. Traditionally, metadata is often treated as supporting information with document tags, file names, classifications, and workflow attributes. But when governance requires metadata completeness during authoring, something very different happens. The content itself becomes queryable. Then organizations can proactively identify missing contraindication metadata, terminology inconsistencies, substance references across markets, or gaps in controlled vocabulary alignment. In document-centric environments, many of these issues are made hidden until manual review. In governed structured environments, they become systematically visible. That missing contraindication metadata immediately surfaces as a visible compliance exposure. And that matters because regulators increasingly operate through structured validation rules and data consistency expectations. And once the data becomes queryable, organizations move beyond static document management into dynamic regulatory intelligence, which naturally leads us into the fourth outcome, which is change impact intelligence. Historically, organizations relied heavily on institutional memory to answer questions like, what else uses this? What markets are impacted? What approvals are needed? What reviews are needed? But governed structured environments fundamentally change that model. The knowledge graph continuously maintains relationships between regulatory meaning, semantic context, usage history, approvals, and downstream consumption. Impact analysis becomes embedded directly into the architecture, traceable, auditable, repeatable, and significantly less dependent on tribal knowledge. That becomes increasingly important as organizations scale globally and operate across larger volumes of interconnected content. Now, once organizations begin operating with this level of visibility, another interesting signal emerges. The system begins revealing not just content intelligence, but organizational behavior itself, which takes us into outcome 5, reuse intelligence. And this is where organizations begin learning something very important about their operational maturity. Reuse itself becomes measurable. In governed structured environments, organizations can see where teams trust the governance model, where reuse is healthy, where duplication is occurring, and where teams are bypassing governed structure entirely. So looking at this chart, some domains show strong reuse patterns, labeling, clinical, CMC. Others are showing significantly lower reuse rates and higher reauthoring behavior. And that matters because low reuse is rarely just an efficiency issue. It often indicates deeper operational friction, ownership ambiguity, governance mistrust, workflow gaps, or structural inconsistency. So here, reuse patterns become leading indicators of governance health. And that's a very important idea because organizations often assume low reuse is primarily a training issue, but very often it's actually a visibility problem. Teams are bypassing systems when they do not trust the underlying governance model, and governed structure makes that operational reality visible. Now, all these outcomes become even more important once organizations begin introducing AI into regulatory operations. So let's move on to the final outcome, AI constrained by governance. This is where much of the industry conversation is heading today, but it's important to frame AI correctly inside regulated environments. AI without governance does not eliminate operational risk. It amplifies it. If the underlying architecture lacks traceability, approval provenance, metadata discipline, reuse controls, or transformation boundaries, then AI simply accelerates inconsistencies and uncertainty at scale. That becomes extremely difficult to defend in regulated contexts. But governed structured ecosystems create a very different foundation for AI. Now, look at the hierarchy shown here. At the base is retrieval augmented reuse, or RARE. This is governance first AI. AI retrieves approved governed components rather than generating uncontrolled new language. Then comes retrieval augmented transformation, or RAT. And finally, retrieval augmented generation, or RAG. The important point here is not the acronym hierarchy itself, The important point is that governance constrains and bounds AI behavior. AI operates inside retrieval controls, lineage tracking, approval workflows, reuse boundaries, and transformation governance. That makes AI more predictable, more explainable, more auditable, and ultimately more defensible. And that's likely where regulatory operations are heading. Not AI replacing governance, but AI operating within governed structured ecosystems. Now, stepping back, all six of these outcomes point towards a broader architectural conclusion. So let's bring it all together. What does this all add up to? This is six intelligent outcomes with one architectural decision. Whether content is governed as structured, reusable data from the beginning, or whether organizations constantly reconstruct intelligence afterward from disconnected documents. Increasingly, regulators assume the former, and the organizations that adapt most successfully will not simply digitize existing document processes, they will rethink how content is governed, reused, approved, traced, and operationalized from the ground up. Because structured content is no longer simply an efficiency initiative, it's becoming the operating architecture model, modern regulatory intelligence. Now, what can you do next? As we think about structured component authoring and where your organizations are in their journey, there are really a few different paths depending on your current stage of maturity. So let's review the first path if you have not yet started with SCA. For organizations that have not yet started with structured component authoring, one of the biggest misconceptions around this is that it requires a massive enterprise-wide overhaul before organizations can start realizing value. In reality, one of the most effective first steps is much simpler. Pick a single content domain, like labeling or CMC, they're usually the best starting points, and audit one content type end to end. Take a single statement, like a dosage statement for one product, and map it everywhere it exists, across documents, markets, systems. And now, what usually happens during that exercise is extremely revealing. Organizations begin discovering just how many downstream dependencies exist around a single governed statement. USPI, SMPC, CCDS, pills, CTD modules, global markets, RIM systems, translation systems, safety systems, and more. And that map becomes incredibly important because it represents your dependency exposure. It shows where consistency risk exists, where propagation risk exists, where reconciliation efforts exist, and where governance gaps exist. And here's the key point is that if your systems cannot reliably produce that dependency map today, that is the gap. Not because teams lack expertise, but because document-centric architectures were never designed to maintain those relationships systematically. And importantly, that exercise is not just diagnostic. The replication and mapping process itself often becomes one of the fastest ways to build organizational alignment around component reuse and governance structure. Once teams visually see how much duplication, dependency, and downstream impact exists around even one statement, the operational value of structured governance becomes much more tangible. And the important part is this is something organizations can begin doing immediately. So let's look at the mid-implementation path. If you're mid-implementation, the key question is no longer do we need structured component authoring? The most important question becomes, did we actually redesign the operating model around components, or did we simply layer structure onto document-centric workflows? And Caroline touched on this a little bit before. Because that distinction is extremely enormous and it really matters. Many organizations successfully implement structured authoring technology, but the surrounding review, approval, adaptation, governance processes, and workflows can remain largely unchanged from the document era. And when that happens, friction begins concentrating in very specific workflow points. And that's what this slide's highlighting. So if you look across the workflow shown here, some stages naturally support component reuse very well, like draft authoring, internal review, submission publishing. But other stages often default back to manual recreation, regional adaptation, cross-affiliate collaboration, variation preparation. And those recreation points are extremely important signals because they usually indicate that the workflow itself was never fully redesigned for component level operations. And that's the critical point. These gaps are typically not training issues, they're adoption design issues. And in many cases, friction concentrates around stakeholders who historically controlled entire documents. In a governed component model, these responsibilities don't disappear, but they evolve. So the practical recommendation here is simple. Identify 3 to 5 workflow points where teams consistently default to the recreation instead of reuse, because those points often represent the highest value operational redesign opportunities in the entire implementation. Now, lastly, let's talk about those who already have SCA implemented. For organizations who are already live with SCA, the next phase becomes measuring operational maturity to determine whether the governance model is actually delivering value. And the focus shifts to operational signals like reuse rates, metadata completeness, reauthoring patterns, and traceability quality. Because the metrics reveal whether the teams truly trust and adopt the component model. For example, low reuse with high reauthoring is usually not a training issue. It's often a governance or workflow trust issue. Most importantly, these metrics should connect back to the business outcomes, faster updates, less rework, clearer traceability, and more scalability options. So regardless of where you are in the journey, whether you're just beginning to evaluate SCA, actively implementing, or looking to expand the value of an existing investment, there are opportunities to engage with peers, learn from organizations already moving through this transformation, and accelerate your own path forward. Where there's interest in connecting with those groups or learning more about what other organizations are doing in practice, we would absolutely be happy to help facilitate those conversations. So please feel free and encouraged to reach out to us. And we really look forward to speaking with you all soon.
Excellent. Perfect. Thank you very much, Marissa. And I know we're just coming up with or up to time. So if there's one thing we'd like you to take back from today, it's kind of these two questions. So first, does your content architecture enforce governance at the point of authoring? Not a layer on top, not as a manual step, but as a fundamental property of how content is created and managed. And second, can your teams actually operate within it? Because having the architecture is one thing, having people who can work within it effectively with clear processes, visible governance, and defined ownership. That's what turns structured content from a technology project into a genuine regulatory advantage. If the answer to either of those questions is not yet, that's completely fine. The work ahead it's specific, it's sequenced, and it's doable, regardless of where you are today, as Marissa mentioned. With that, I know we're just at time. We're happy to stay on if there's any questions, or please do feel free to reach out to either myself, Marissa, Red Nucleus, Docuvera as a whole, and we'd be more than happy to continue these conversations. Okay. Excellent. So for those that can stay, we have had one question come through. So question is, once customers have been on Docuvera for a while, what are they actually measuring? They're curious to know what some numbers tend to look like in practice. Marissa, maybe that's one for you.
Yeah, definitely. I can take that, Caroline. So, over time, customers usually shift from measuring platform adoption to measuring operational maturity and governance effectiveness. So, initially, organizations tend to focus on component reuse rates, reduction in manual reauthoring, metadata completeness, and authoring efficiency. And we've seen over the course of time, reuse increase up to 80% for customers that adopt structured component authoring after a year or more that they've actually had their teams in the systems with hands-on and authoring from end to end. It does have a ramp up period, but we do tend to see that trend of reuse mature up to 80% across organizations, which is huge. And as that implementation matures, the metrics become much more strategic. Organizations start measuring things like cross-market consistency, traceability coverage, impact analysis speed, reduction in reconciliation effort, the propagation visibility that they gain, and government adherence across teams. So one of the most interesting metrics is reuse behavior itself. And healthy reuse patterns are often a strong indicator that the teams trust the governance model. Conversely, high reauthoring rates often signal workflow friction, unclear ownership, or gaps in the operational model. So that's what I would say would be some of the examples of numbers from a perspective of what teams are measuring for reuse rates, and then some other metrics that will evolve after the time in the system and SME usability of their particular structured component authoring platform.
Excellent. Perfect. And we have got a couple of other questions, but perhaps we can follow up with those offline. I'm conscious of everyone's time, but any questions from anyone else on the line today? Okay. Excellent. Well, as we mentioned, if you do want to continue the conversations, if you have any additional questions, please feel free to reach out with it to us. We'd be delighted to connect. And thank you all very much for your time today. It's been a pleasure.
Thanks, everyone.
Thanks all.